Hello, Professor.
Yes.
So, my name is Milan Patel, and let me introduce my group first. Oh, okay, sir. Milan Patel.
Milan Kumar.
Yeah, Milan Kumar.
Okay, let's try this.
Oh yeah, तो यार तो ऑफिस पर कितनी साइड पे फिर आवाज भी पड़े मैंने हमारा मिल पर करना आज नहीं तो
Let's close the third. Okay. The first one. Yes, sorry. The first one.
So later I have sent it to with attachments.
Next time I'll
You all need help with grammar. You all see
performance.
Look at my fantastic. 520. And this sort of there. However, there is no natural.
Should I start, Professor?
Give me 1 second, please. I need to take down these names.
Okay. So we are giving presentation in sequence, sir. Like what I wrote in the presentation, we are giving in sequence.
Okay. Patel seems to be a very popular name.
Yeah, it's from particular.
There are lots of kind of Patels, sir, not only one kind.
From Gujarat.
Really?
Yeah.
How many kinds are there?
Like Leva Patel.
I thought they were only human kinds.
Patel has no culture because they are connected with agriculture.
That's the second.
Basically, they are farmers.
Farmer. Oh, farmers. Oh, I see.
ठीक है सेंटेंस है टॉपिक अच्छे भी
I think Muhammad is the most
Guys,
Please. Yes, sir. Speaker. धोखा तो नहीं आया
नेक्स्ट टाइम
Then
कपड़ा
what have you done?
ओछा राहिले हो कवर हो जाए मतलब मैं तो
થોડું વાંચી નાખે બાકી એમને બોલતા પહેલા જે લોકોએ આપી ને સાંભળે છે કૃણાલ કે કૃણાલ બેન કૃણાલ પહેલા એ આ લોકોએ આપી જે લોકોએ બોલ્યા છે
There's
I don't know the content, he doesn't know the content, even he doesn't know the content. And actually, I could follow the situation topic.
Yes, professor.
We can't hear you.
Okay, now.
Raise the speaker.
Hello, professor.
Hello, hello.
नहीं संभल
Hello.
We can't hear you.
I think there is problem something, Professor. એટલા માટે તો બોલી રહ્યા.
Okay, guys, relax. Please.
નંબર આજી.
हेलो हेलो
Excuse me.
क्या पाછળ છે?
પાછળ જે વાયર છે ને તે શું?
Next time the exam in class.
એવું ક્યારે કીધું? ફાઇનલ એક્ઝામ
કાકા કીધું લાસ્ટ વીક
તો આપી દઈશું જોઈન તરત જ ફટાફટ 10 મિનિટ અથવા તો
Professor, can you hear us now? Professor?
Yes, thank you. Yes, thank you.
Okay.
So can we start, professor?
Yes, please.
Okay, so myself Milan Patel, and we're going to present about personal electronic health devices. So next slide, professor, please. Thank you. So this is the index. So basically we cover 7 devices. We didn't mention about FDA here because we chosen like all devices which are approved by FDA, so we didn't mention in our slide. And I'm going to present about what is personal electronic health devices, and I'm going to pick 2 of the example: my last cigarette and blood pressure and pulse monitor. So next slide, please. This is the second page of index. Next slide. Thank you. Okay, so what is personal electronic health devices? So before that, I would like to ask you, what is electronic devices? Forget the health right now. What is electronic devices?
computer is electronic.
This is easy. There's no trick question to it, right?
Yes, this is easy question. Still people thinking.
Mobiles like a machine?
Yeah, mobile phone, MP3 phones, camcorder, camera, iPod, iPhones. So, and what is now electronic health devices? So,
related to health
yeah, so,
City scans.
yeah. So
MRI.
which electronic devices help in the healthcare system? It's called electronic health devices. And next slide, professor, please. So commonly how they design, and they commonly designed by like plastic casing pump, and then at least one circuit board in them, then one heating element, then overheating protection system, then transformer system, and after they ready, right, they're gonna be tested like flammability test and circuit design test. Same as like while our mother is preparing food, right? Then before serving the food, she gonna taste the food first, like salt is enough or spiciness is enough. Then she gonna serve the food. Next slide, please. So these are the common electronic health devices. So electronic toothbrush, like the relevant picture is by side, are by side. So nebulizers. So small baby is using the nebulizer. Then face steamer, a girls on the top. Then mattress replacement system, the blue color mattress. Then sterilizer, all the way in the corner last, and then oxygen concentrator. The lady standing on the ground with, like, you feel like that you're getting more oxygen, so you feel like that you are outside or something in good areas. Next slide, please. So let's start with the example. So my first example is my last cigarette. So this is a kind of software we can use in the smartphone, PDF phone, iPhone. So how the software works? You just have to enter the number of cigarettes you are smoking, and the software will tell, like, what's gonna happening, like how much nicotine level in your blood, how much then carbon monoxide level in your blood. And after downloading this software in your system, in your iPhone, you're gonna get the daily motivation quotation and some kind of pictures, like monster picture, like if you smoke too much cigarette, then this is gonna happen after 3 years to you. And they're also gonna tell you about the risk of lung cancer, heart attack, and also like how many money you're gonna save if you not like smoke too much cigarettes. Next slide, please. So the software basically look like this, like the charts are look like this. So you can see that the heart attack after having one cigarette, you shorten your life by 6 hours and 14 minutes, and like how many money you're spending. Or that this way, like if you didn't smoke 3 pack of cigarette, you're gonna save this much money. Next slide, please. This is the second example. Blood pressure and pulse monitor. So I remember before 3 years I went to a doctor, and he need to measure my blood pressure. Then he came with the long kind of clothes, and he rolled up the clothes on my hand and start pumping and start taking reading. Even he couldn't take his phone, like he cannot answer his phone because of like he has to concentrate on reading. So, but nowadays we have a modern technology, like even he can measure a systolic and diastolic blood pressure in a second, like 2-3 seconds. So the time he can save the time and like paying attention in different things. And the next slide going to be presented by my friend Srikasa.
Thank you, Milan. And the next topics I'm going to discuss about is like women's health, wearable insulin pumps, and medical alert records, and biofeedback, and inner activity. And when coming to the women's health, the most of the tests used by the women are like pregnancy test and the ovulation test. In the pregnancy test, the sample is mostly used is urine, and if one kind of hormone, it's HCG, it's like human core ionic gonadotropin hormone. If the hormone is present in the urine, we can confirm that like she is pregnant. And coming to the ovulation test, and in this ovulation test is mainly used when you are planning to get pregnant. Mainly like when urine is taken as a sample, if the LH is like luteinizing hormone surge, it is in the urine, then you can you are in particular stage to get pregnant if you are gonna by conception. And it is like 99% accurate, no side effects of these two tests, and mostly usable, and it's cheap. That's it. And the next topic is like next slide please, sir. It's like wearable insulin pumps. These are mostly used in type 1 diabetes mellitus, and these are non-insulin dependent diabetes. And these and in this. These, I mean, like the therapy is mainly given by insulin, and most of the medications is not used in this, and it's like a wearable, and it will be easy to wear and easy to maintain also, and it's like a pager, size of a pager, and it's like a plastic case that has a large needle with a pump monitor, so that this pump is connected to the batteries, and these are mostly used by the people who are suffering from type 1 diabetes mellitus, and the disadvantage is like it's very expensive. And coming to the advantages, and compared to the injections, like we have to remember every time when we have to take the injection, when we have to take the injection like that. So by wearing these insulin pumps, so we no need to remember if we have any decrease in the blood sugar levels, it's gonna inject the insulin by like it's like a medication process, it's gonna give by drop, so that we can maintain our blood level normally. And coming to the next topic, like next slide please sir. And it's a medical alert and records. These are most commonly used by everyone, if we have any emergency like that, we don't know, when we get when we get accidents and all those things, and if we are in any emergency, nobody knows that we have any allergies or we have any other diseases or we are suffering from any other chronic diseases, and when we get into the hospital, so nobody is gonna start the treatment without taking all our physical laboratory test reports and we have any allergic to anything, so and so. So by wearing all these things, we can prevent errors and save time and in accuracy, and it also decreases the patient out of pocket expenses because the hospital is going to charge a lot of amount for their physical examinations and all those things. So if they are wearing those things, so it will be easy for the physician and even for the patient, so they can cut out his pocket expenses. And these are also called as a history of medical identification. Next slide please sir. And the next topic is biofeedback and inner activities. This biofeedback is a therapy to get feedback from our body to measure how relaxed we are and to avoid stress mainly. These are also called as neurofeedback therapy. So these are like external sensors gently stick to the skin to monitor what is going inside our body. It is going to detect our stress levels, and because of stress, in the future how the patient is going to affected by a lot of diseases. If we are going to use this, so we can know what's the happening in our body, so that how our stress levels are. So by using these and we are getting aware of this, we are going to control the stress levels so that we are free from the most of the side effects what we are going to achieve in the future. So these are things, that's what I discussed, and next thing was discussed by Deep Patel.
Next slide please. Yeah. Hi, I am Deep Patel, and I am going to start with the last device, that is the digital plaster, and we'll end up with the technologies which are used in the healthcare. Well, the digital plaster is the device which is sometimes the wireless too, and this one keeps monitoring and sending the data from the human being to the operator system. That is sometimes it's blood pressure, temperature, or blood glucose levels. These digital plasters are really kind of convincing, and they are also in really small shape, so that will be easy to use. Moreover, these digital plasters having silicon chip which is powered by minor batteries, and thereby it sends a data to the operating system, which is moderated by some physician or some doctors. Next slide, please. Thank you. Well, the technology which is mainly used for the healthcare system is based on the two things I am going to discuss. One of those is sensor, and the another one is telecommunication. If we talk about the sensors, then sensors, there are mainly two kinds of sensor. That is, one is basic vital sign sensor. These kind of sensors are mainly used for those patients who cannot express their feelings or their symptoms. And next slide. Yeah, like if we take an example of a baby or some old patient or the patient who is in coma, exactly speaking, they cannot express their symptoms or what they are feeling. These basic vital sign sensors can send the symptoms correctly to the operator or the system receiver, where everything happening to them will be recorded and will be explained. Uh, Next slide, please. Well, the glucose level measuring sensors, as Kasa told, this insulin pump that is based on this glucose level measuring sensors. These sensors are the devices that measures the glucose blood level and will make insulin pump to react on these sensors, so that will release the insulin pump. So this is the another kind of sensors. Next slide, please. Well, the another technology which is used for the healthcare, that is communicating networks. In today's world, if we think about the communication, then in this healthcare industry also is sometimes relevant to this communication network. Nowadays, sometimes patients are not able to see the physicians due to their condition or the surrounding condition, where they can use this communication network and they can present their ideas or what they are feeling with. I'd like to talk about it in the next slide. Yeah. If you just think about the communication networks for the healthcare, then patient is not feeling well, then they can call the physician, and physician can give them the telephone prescriptions, which will be sent by physician directly to the pharmacist, and by that way the pharmacist send them the relevant medicines. So communication network nowadays is also relevant in healthcare industry, and it is not that much developed yet, but by the time being there will be some changes in the communication network for these healthcare records, and I hope it will be developed. And next topic will be discussed by my friend Shalin Patel.
Thanks, Sudeep. My name is Shalin Patel, and I'm going to talk about the electrotherapy and electrosensitivity. Does anyone know what is electrotherapy? Alright. And the electrotherapy is one kind of electrical stimulation for therapeutic use. And technically, it is a kind of energy waves which is a part of electromagnetic spectrum that produce the physiological and chemical effects in the human body. The main mechanism of the electrotherapy is to block the transmission of the pain signals and along with the nerves. The electrical stimulation has been shown to promote the release of endorphins, which is produced by the body. And the endorphins is nothing but the painkillers, which reduces the pain. There are mainly some kinds of the electrical stimulation devices, like for example like the transcutaneous electrical nerve stimulation, then interferential current, and then gravitational stimulation. But among all these, the transcutaneous electrical nerve stimulation is most widely used, and this all apply electrical stimulation is to the nerves and the muscle via adhesive pads, and they are applied on the skins. the most of the devices have the batteries which allows the power, and some of the units have the adapters that allow the powers from the outlet, and there are very rare chances of the causing the side effects, but sometimes it causes the skin irritation because of the adhesive pads. There are mainly three purposes of the electrotherapy. First of all, the pain relief. Then the second one is the stimulation of the psychological changes, and third one is the muscle contractions. As you can see, the guy who is sitting over there, and he got the back pain, and he put the adhesive pads which reduces the pain in his back. The electrotherapy uses the electro signals to interfere with the transmission of neural pain signals into the brain. It slows down the neutral signals transmission to lessen the pain and make it more bearable for the patients. Sometimes they use the analgesics and inflammatory medicines in the treatment plan. Next slide, please. The another purpose is to stimulate the physicochemical changes. The electrotherapy uses the electrical signals to introduce the heat in the deeper tissues. The deeper tissue, this deep heating produces the increase the blood flow from the affected areas in order to improve the drainage. Then the third purpose is to stimulate the muscle contraction. During the rehabilitation, it draws a specific amount of the current into the affected areas, and then it has to relieve the muscle spasms and to re-educate the muscles after the trauma, and it also helps to prevent the muscle atrophy. Next slide, please. Thank you. Electrosensitivity is unhealthy sensitivity to a particular source of the electricity, just like mobile phones, computers, and even minor electric equipment. Electrosensitivity is nothing but just caused by the exposure of the electromagnetic field, and the electromagnetic field is produced by the electric charge objects. There are some symptoms of the electrosensitivity, for example, like skin problems. Sometimes it causes the skin irritation also, headache, fatigue, fainting, light sensitivity, and heart problem. Sometimes they also produce the dizziness also, and the tinnitus is also causing by the electrosensitivity. Tinnitus is nothing but the sounds in the ear, which is the absence of the corresponding external sounds. And some of the diagnosis of the electrosensitivity is one of my friend Kelvin is going to continue with that. Thank you, Professor.
Thank you, Shalin. Next slide, Professor, please. Here my friend Shalin explained you what is the electrosensitivity, but why this electrosensitivity due to the electric device is due to the, it occurs due to the electromagnetic radiations. So every coin, as we know, every coin has a two sides. My Deep Patel, he is my friend, and he is explaining about the mobile phone and laptop is the electro device which are not only the used for the communication purpose, but today's is also used for the telemedicine network. So how it diagnosed? Electrosensitivity is extremely difficult to treat, so we have only one option, and that keeps some distance from there. Build the electric tower in the non-residential area or far from this area. Keep some distance with routine electronic device when they are not in use, like mobiles and laptop. Next slide, please, Professor. Here you can the term electrosmog. The electrosmog means the pollution from the electronic device, like electronic source. So here you can see the tower near the residential. So the thing is that we need to stabilize this tower from the non-residential area to prevent the electronic sensitivity. Here is the one lady is sleeping in the bed, and his mobile device is little far from his bed. So here she tried to decrease the electrosensitivity as much as possible. Here you can see also this baby got a mobile device. Next slide, please. The finally conclusion. Here this girl is surrounded by the electronic magnetic radiation. You can see. Think about that. If there is no any electronic device, where what happened? It's like a life without water. Next slide, please. So the not only in the medical field but also in the engineering field and any kind of the technology field trapped by the electronic device. So my first friend explained you about the 7 electronic device which are used in our healthcare management for improve the quality. So here the same thing, the technology like the sensor and the communication which is explained by my friend Deep Patel, that are also how to use in improve our healthcare system. Thank you, Professor.
Okay, any comments about these guys?
The topic is clear and up to the mark.
The topic is very broad, but we try to cover most of the things in a short time.
Good topic.
I would like to comment about a negative topic. Like we should ask audience after each individual presentation finish, like any question or like, but we didn't do that.
You can do it now.
Yes,
But no audience, sir.
there is no people too much.
Like two.
Well, there are people here.
Oh yeah, it's coming now.
Actually, we went to send you the email because the
Any questions,
internet
guys?
started. This
Any
Any
questions,
questions?
the guys over there in Virginia?
Or here?
Yes, there are people here. You can ask them any comments or questions.
Any comments, guys? Even professor.
All right. I do have comments. So where are the rest of the students, by the way? Are they coming back?
He went. Half of students finished their presentation and went in a home, I think, and the half of
Went to get a coffee.
Coffee
half of
and,
student go to
Prepare
the
for-
send you email.
and,
I think 4 people.
and half of that like discussing outside about their presentations.
Okay.
group
Can you please invite them in?
Yeah, we are already here, Professor.
Yeah, they came, sir. They're coming.
Kunal.
Well, I feel it was a very impressive presentation.
Thank you.
Thank you,
Thank you, Professor.
It was a good introduction of the topic at the beginning when you started with the index. Although it would have been best if you would have introduced the team members as well. But you did introduce the topic. There was good engagement of the audience initially and in the middle as well by asking easy questions. You asked very easy questions without putting anybody on the spot. So it was a general sweeping kind of a question that anybody could have tackled. It was very easy, very engaging, a very good start, easing into the presentation. You had a very good utility of very interesting pictures, very relevant and very interesting pictures. Although they were getting to a point of being a little much, there were too many pictures, but I wouldn't say that they were kind of irrelevant or they were boring. They were all very interesting. And then you also went ahead, some of you guys went ahead and described each and every picture as well. That look at that lady next to this thing, or look at that man, touching his back. So that was also good. Very impressive use of the phrase, "my last cigarette." Very, very catchy, I must say. It certainly jolted me and I just was very attentive. But what are they going to say here now? my last cigarette. Very dramatic, very interesting phrase. So phrases like this certainly, keep the interest there in the audience. Or humor. I mean, I've noticed that nobody creates any humor. None of you guys have ever created humor in your presentation. I mean, you're taking these things too seriously. I mean, you should. But the thing is that the beauty of a good artist or a good trapeze artist or a high wire artist is that they're doing it with a smile. They make it look so easy. They make it look, like as if it's like as easy as 1, 2, 3, but it's not. And how do they do that? By smiling, by gesticulating, by engaging people, and by creating funny comments. They may be doing something extremely difficult, but they do. So humor would have been helpful, but that line was very engaging. My last cigarette. The slides are very clear. There's just the right amount of ink. Not too much, not too little. I really like the choice of font. Very clear, very crisp. There's no confusion. The font size, the font style, excellent choice. The transitions were all great. Each one of you transitioned very smoothly. You all introduced the next person almost by their names. And you said, they're my friend. You could have used my colleague, my team member, but you did use some kind of a title. Most of you guys used the title friend, which is a good thing. If it's a very conservative presentation, with a very conservative audience, then friend would not be ideal in that situation. Here it's fine, but when you're talking about very conservative place like the academia or health or not a classroom setting, you probably would not use friend. You want to say my team member. Since you guys are already at this stage, I can also, I guess, say something beyond, because obviously, when we're still struggling from, on a scale of 1 to 10, if you're still struggling at stage 1 or 2, I can't really share my thoughts about how to bring somebody who's at an 8 to a 9. But since you guys are so high up there already, I think I can share a little bit about how to even take it to the next level. And that is that anytime you're introducing anyone, it is great to establish confidence in the audience for them already, even before they say or even step onto the stage. So you can say that, now Deep Patel is going to step up and he's going to talk about he's going to talk about electrotherapy. And Deep Patel has 2 years of experience just in this subject. He has worked with an electrotherapeutic company since 2 years, and I think he's an expert on this topic. And here he is. So this actually cultivates confidence in Deep Patel already. So even before Deep Patel even appears on the stage or even utters the first word, I'm already sold for Deep Patel. I'm like, oh my God, Deep Patel, the expert, is coming. He's going to tell me about electrotherapy. And that is also true that you do it in hospital setting as well. So for example, if a nurse is going to take you, if you just nurse finished examining you, and then there's some blood work that needs to be done, and the phlebotomist is coming, nobody likes to be poked with a needle, right? I don't. I bet you guys don't either. So everybody, all the patients who are waiting there to have their blood drawn, they're already very anxious and very nervous and very scared, very fearful. They're all the negative aspects. But if my nurse had spent that 1 extra minute in introducing the phlebotomist and establishing the trust in me, I would be much more relaxed. If she were to say just simple things like, oh, now Joe Schmo is going to come in. He's a phlebotomist. He's been with us for the last 5 years, and before that, he had been working for University of California for 10 years. He takes about 50 samples of blood every day, and he's been doing it for 15 years. So you do the math. He has taken 1,000 and 1,000 blood samples, and the way he pricks with his needle, you won't even feel it. And then she leaves the room. I would be so relaxed by the time the phlebotomist comes in with his needle. So that is that you are already setting the stage for the next person on your team, because you are on the same team. Their success means your success. Their failure means your failure. So the phlebotomist's success with the blood draw is the nurse's success, and it is the whole hospital's success. So you guys did excellent job, but I'm just taking to the next notch, because you guys are ready to be taught to be at the next notch up, is to introduce the next partner in a manner where whatever they're going to say, everybody has already bought the idea, because they are considered as an expert in electrotherapy. Okay, moving on. The speed was excellent. Nobody was rushed. There was no, although you guys went over time, by the way, which is a negative thing, but since everything else was so great about you guys, that I'm going to obviously ignore that. So your speech, the speed was excellent. No rushing. I felt that you were engaging. You were convincing. You were helping me understand, because I need some processing time in my brain to understand what you're saying. So that was great. Then whoever would come in, the person who would come in after the first and the second and the third speaker, they would always thank their predecessor, which is a good thing. And then a couple of you, especially the second presenter, the lady, she actually, although you guys had already used the index to describe all of where you guys were going with your ideas, that lady further described what she's going to say. Okay, I'm coming in, this is my name, thank you very much, and this is what I am going to talk about. So she drew a separate roadmap for us to understand where this presentation is going. So excellent job, wonderful.
Thank you, sir.
Of course. There was very little reading. There was reading, but there was very little reading. Whatever you guys were doing, you had cue cards or whatever you were doing, I can't see it, but it did it. You were able to pull it off. It did not seem that you were reading a script. That, oh my God, this guy is just kind of a newscaster. So which means that you were able to create more rapport with the audience by not reading it all the time. There were some hand gestures. I do want to say that the ladies' hand gestures were repetitive, so they were not very helpful. It is good to do hand gestures, but they were just like, I don't know if you guys know of this expression called monotonous. Monotonous means that they were just one tone in the voice. So without any upscale or low scale in your tonality. Similarly, the hand gestures were the same. They were just, these were the hand gestures.
Yeah.
This is it. This is not helping. This is not helping. So the gestures could have been that you do this when you want to stress something. When you are not stressing something, then you stop. Right? You don't have to do it all the time. This is not helpful. This is not helpful. This is helpful. Alright? Or changing it, or do something else. Change it. It's very monotonous. Just the way if I were to talk in a monotone, I would not be doing any lumps and downs in my voice. There would be no crescendos, no decrescendos, so it would get boring, people would go to sleep. So I have to be very dramatic, I have to be loud, low, up, down, all those things. So you gotta do that. And there was no footwork, by the way. Very little footwork. You should move around. Be confident enough to move around. So hand gestures are supposed to help with emphasis on words and the understanding of the material. So use them. And footwork also shows your confidence and how much at ease you are in front of all these eyes watching you.
Um, then I must appreciate the professional attire. Everybody is business casual, which is good. Nobody's wearing a t-shirt. Everybody's wearing a full sleeve shirt, button down shirt. What else? Oh, can we go to the last slide, please? Very wonderful connection. If you notice the connection of the whole thing, the whole story, the whole story, and then ends and it connects to what? Quality improvement in healthcare management. Oh my God. The main thing. See, it's beautiful. It's beautiful. The whole story ends and takes you right back to where we're supposed to be going all along this whole semester, which is quality improvement in healthcare management. Wonderful connection. Very impressive. I loved it. So thank you. Thank you very much. This was an excellent presentation.
Thank you.
Thank you, Professor.
Thank you guys.
Next in addition to the camera.
Oh, see, nice. Practice a lot. How many times you guys practice this?
4 or 5.
4 or 5 times, Professor.
Right. And then there was a lot of pre-reading.